Am I going live
You're
at the
live.
same time? I'm live. Hello.
Live.
Oh, wait. I'm live on YouTube and I'm live on TikTok, but you can't see my herbs. I want to make sure people see my herbs. Okay.
Can you pick it up?
All right. Can you see my herbs behind me? Look at that mint.
So there's a- yeah.
Wait, can you see my herbs here, guys? Look at that. Every Mother's Day. Yeah, there it is. Every Mother's Day, my son used to plant my herb garden this year. Travis did my herbs and these self-watering herbs planters. I mean, my hair is a mess. Anyway, hello, it's Tuesday. A long day. We decided to do the live outside today. For those of you in the north, let me know where you are joining from. I am in northeastern Ohio. So we've had the worst, coldest winter in a long time that I can remember. So it's been super cold today. I'm actually in shorts and outside, and I try to come outside whenever I can. It's a little bit hard, but I think it's really important to get some sun, not only your vitamin D, but the grounding. I have my bare feet and I'm walking around. So I hope all of you guys are getting some grounding. But tuning in here Tuesday, today I did a lecture for really with Vibrant Labs. Super interesting test. I had a couple meetings today. So one of them was Vibrant Labs. They do a urine metabolite test. So I know you guys, I'm always teaching about testing, and they have a new test that just came out called a hormone zoomer. They actually have ways that you can test in your urine, not only your hormones, but endocrine receptors. So I did my test. I found out that I have low levels of atrazine. Atrazine is a chemical that can be found in like pesticides and golf courses, which is interesting because I did start golfing again last summer for the first time in 20 plus years. But we only went like once a week from August to November. So I had high levels of that. And so endocrine disruptors are something that can change your hormones in a couple different ways. One, they get into the receptor. So think of a receptor as a door. You open a door and you go through the cell. And that's how the hormone works, by getting into the cell. So 1, 2, it blocks your hormone's entrance into the receptor. So it could block it. 3, it could signal it. So it could change the signaling. So there are thyroid hormone disruptors. There are endocrine hormone, androgen ones. So for men, blocking testosterone. Also for women, and then estrogen ones acting like estrogen. So that's part of the reason we're seeing girls with puberty earlier. We're seeing problems. So this test is so exciting because I had atrazine, and I thought that I've detoxed long ago, but I know that I have my enzymes that do detox. I have genetic alterations in them, but also I had low levels of BPA. So BPA is in the plastic bottles. So I had replaced all my Tupperware into glass. It's one of the things you do. So just a reminder that sometimes your hormones can be off because of your environment. And so endocrine disruptors. So have you guys switched out your Tupperware to glass? Are you using a reusable water bottle and not doing the water bottles? Let me know if you guys have gone through that detoxification, and have any of you guys actually tested your toxins in your urine. So that's a test that's available now called the Hormone Zoomer. And so I was doing some boot camps with them, some lectures. I also had a call with another lab that has a really interesting new test that's based on fertility. So I'm going to probably do a webinar for them this August. And so a lot of this is aimed at providers, but a lot of times it's free education. So if you were so inclined and you guys were interested in watching, you could look at it. So that's what I've been up to today. I'm happy to answer your questions, whatever questions you guys have about hormones. I just thought that was interesting about endocrine disruptors and being outside and everything like that. If you guys have any burning questions about metabolic issues, thyroid, female hormones, any of those things, I'll take as many questions. I don't know if the landscaping is going to go, if it's going to be too loud, or we're going to have to go inside.
Oh, he's just sleeping.
What do you think? Okay. Trying to get my son. Oh, you can still hear me. Okay. All right. Hey, Letty, good to see you. Let me know what questions you guys have. So, okay, awesome. So that was the big takeaway from my lectures today. Anyway, again, these were mostly towards other practitioners. You didn't have to be doctors to be on those lectures. It could have been health coaches or dietitians or chiropractors or anybody who's interested in coaching people into wellness. So this was a couple different labs. So I did 2 different calls today. I think I've done a total of, I don't even know how many hours this month I have done of teaching, let alone having to recertify my integrated medicine board. So every 8 years, we have to take the test again. So this is the first time I had to take it again, and it's a big test. And then every year I have to recertify my OB-GYN boards. Okay, Letty, thanks for the first question. You're 52, ablation 3 years ago. How I know in menopause? That's a great question. So with the endometrial ablation, you don't have the period. And the definition of menopause, you're right, is 1 year without a period. So we usually do labs to be able to understand if you're menopausal. Again, you have to have 2 separate labs about 4 months apart. One FSH, an LH, and estradiol, mainly just the FSH and the estradiol. And the estradiol should be less than 40, and FSH above 40, and the estradiol should be lower. So FSH above 40 2 times. Now I put the estradiol in there too. So we would do a whole set of labs 4 months apart for our patients to be able to tell. Now keep in mind that I am 56 and I've gone 8 months. So if I would have used that reasoning to diagnose myself in menopause, I would have thought I was menopausal 3-4 years ago, and I'm still not officially menopausal. So that's the inexact way that we have. You could still have ovarian activity. You could still have ovulation. So your hormones could still fluctuate, less likely, but that's how we do it. Josh, you've gone 25 years without a period. Somehow I'm wondering if you are someone who menstruates, but thanks for letting me know. And thanks for the gifter. So yeah. So it makes it really difficult if you either have an IUD and you don't bleed, or if you have an endometrial ablation like you, Letty, or number 3, if you actually have had your uterus removed. Why does it cost $2,500 just to get an appointment? Well, that's not for one appointment in our office. That includes your testing. That includes 2 visits with the house coach, 2 in-body scans, 4 appointments. So it's not just one appointment. It's a whole package. And it also includes a supplement, gift card, $100 of supplements. So it's not just one appointment. It's a lot of other things. And it's just, we just found that people are more invested if they pay for everything up front. Just like if you would buy a subscription to something or a package, then they're more apt to do the work if they have the 2 visits with the health coach and they've already paid for them, and they have the 2 in-bodies, which are body composition, and the 4 visits and the test, and some other things. I think it includes some other things. So that's why it's not just one appointment. Considering testosterone, currently at 19, what kind do you suggest? Great question, Letty. A lot in the news about testosterone, so let's just take a second to talk about it. According to the Menopause Society, the reasons to take testosterone are postmenopausal women, low libido. But I will tell you that testosterone does so much more than that. It actually can help your muscle stamina, your mood, your energy, brain function. So a level of 19, our lab is 16 to 55. I don't know if you're using the same lab. So there's a lot of things it could do. We don't like for you to actually take it orally. So you have to either take it topically, which has to be compounded, or it has to also be injection, or something called a troche, which is sublingual. Slippers Comfy, thank you for the kind words, but basically there's lots of other people in our practice and lots of other options, but for our practice to be able to see people, there's other options. And we did also for a long time go on insurance, but insurance doesn't reimburse us for our visits. They only want us to see 15 minutes, but you can think what you want. Let's see, what else questions do we have? So back to the testosterone for Letty's question. So I have mainly in the past been giving it to patients topically because that was kind of the gold standard. But I found that it works a lot better for people to do a sublingual. So that's what's called a troche. So you put it in your mouth, it dissolves in your tongue, it goes directly. And the thing about that is it gets in quickly, but then it also gets out. So a lot of times you get like kind of these peaks. Now, a topical is going to go in and kind of stay in your sub-Q. And so some people like that because then it kind of gives you a slower onset of action and stays in there versus like a very erratic dosing. So it really depends on the person. It depends on how you're going to monitor. When you do a topical testosterone, you do not see the serum levels change. So it becomes a little bit harder to monitor because you have to monitor it via saliva. And again, that's a test that isn't covered on your insurance. Yeah, so a troche, depending on what part of the world you're on, if you're in Australia, they say troche, but it's basically sublingual. You've probably done something similar with a vitamin lozenge. The difference is a lozenge technically is something that will just have efficacy in your mouth. So like a sore throat lozenge. A troche, might be like your vitamin B12. It's technically a troche because it's meant for systemic absorption. And those are just pharmacological terms. But to you, it might be the same thing. It might be like a sublingual vitamin. And so it's got a little flavor to it and it dissolves. So some people like it. I actually kind of like it better, and I'm switching to have a lot of my patients now take their testosterone that way. And even though it's kind of a pain to do it twice a day, they do it in the morning and then maybe also at dinner time. I think that patients are getting better results from that than the topical. Some of my patients really love the topical. And when we do the topical, instead of putting it in a cream, we'll put it in a gel because the studies have shown that the gels kind of penetrate the skin and get absorbed a little bit quicker than the topical. So lots of controversy in the past on testosterone. There was also a study that was published in 2019 that was called the Global Consensus of Testosterone that looked at the benefits and risks. And what they came out with that is that there's no increased risk of cardiovascular complications for people who take testosterone, and as well, no increased risk of breast cancer. So that's super important. Okay, Crabby F. Itchy ears. So itchy ears, you start to get that as a more uncommon symptom of menopause. It could be the low estrogen all the time. I've often seen it to be low androgens being your DHEA and your testosterone. Ariana, is it normal to see bow lines on my nails after changing my estradiol? What do you mean by bow lines? Do you mean like the ridges that are the same length, like vertical or horizontal? I don't know what you mean by bow lines. But it's interesting, Ariana, that estrogen levels and nail hardness, like if you have low estrogen, your skin and tissues are going to be weaker. So I'd expect that getting a higher dose of estrogen, you might have an improvement in your nails. Okay. Crabby F, I'm 60. Okay, so I'm wondering, Crabby F, it might be more common to have your DHEA. Okay, fingers crossed. Is it normal to have cramps a week before your period? So that usually goes along with low progesterone, high estrogen. So the cramps on your period are from the contractions of your uterus pushing the blood through, but the cramps before your uterus are usually before your period are usually low progesterone. Ariana, they're horizontal. So sometimes that's associated with a vitamin deficiency. So I'm not really sure, Ariana. I'm very distinct. Interesting. Okay. I'm assuming your estrogen was increased. And so I would also maybe look into some gut issues and maybe some nutrient levels as well. Okay, Christine Jones, frozen shoulder, hip pain, plantar fasciitis. I'm 63. Pain is terrible. Well, I'm sorry that you were going through that. Some of these ligamentous injuries are associated with the hormone changes in menopause. One being the lower estrogen, where you have increased inflammation. Two being the lower testosterone, and also a form of testosterone or the precursor to testosterone would be DHEA. So with those symptoms, you have more inflammation. Some things that could be really helpful to you are turmeric or curcumin. Some people take it with black pepper. And then also, I'm not sure what your symbol is, but BPC 157 is also great. You're right. Lots of things that are really helpful. Oh, and we have Sarita Bakuni watching from Chicago. I'm not sure if she's still in Chicago, but yeah. So a lot of those, Christine, those are maybe not published indications for taking hormones, but I have a lot of patients that's the reason they take hormones is because of all the joint pain. Momo, is there a hormonal connection with Vyvanse in women? Cortisol increase, acne, hair loss? Absolutely. Vyvanse is often prescribed for adult onset ADD. I'm put it in quotes only because ADD is a diagnosis of description, which means there's not a blood test to do it. It's a set of questionnaires, and then they make the diagnosis. And a lot of women that are put on Vyvanse have in perimenopause have cortisol issues. So you're spot on, Momo. So cortisol's high. Acne is a problem with high testosterone initially, and also it could be low estrogen relative to testosterone. And then hair loss can be both a problem with testosterone and estrogen. YouTube question. I started taking medroxyprogesterone for 10 days to induce a period. On day 3, I started vaginal hemorrhaging and almost passed out at work. Should I stop the meds? That definitely sounds like a situation that you need to contact your doctor out. Those are situations where you need to get evaluated. Typically, when you take medroxyprogesterone acetate, after 10 days of taking it, then you have the withdrawal bleed. So the fact that you're having bleeding early, I would definitely contact your doctor. That doesn't sound like a normal occurrence. Okay. Fingers crossed. Number 3, how can I normalize my progesterone and estrogen? Okay, well, that's a loaded question. If you are a younger patient, some people have success with seed cycling, which is 2 sets of seeds in the first 2 weeks of your cycle and 2 sets of seeds in the last seeds of your cycle that can help your body naturally. Sometimes Vitex or chasteberry can help your hormones induce naturally. Estrogen, sometimes with phytoestrogens and soy. Other than that, low stress or combating stress with breathwork, meditation, exercise, movement, eating clean, eliminating caffeine or lowering caffeine, eliminating sugar, an anti-inflammatory diet, and also genetics has a lot to do with it. Okay, FB Tampa had frozen shoulder and shingles. Then frozen shoulder went away. You were 51. So yeah, I've seen more and more, and with you guys sharing your stories on social media, we're learning more about it too, because I would have never known that shoulder was a problem with menopause. I would have kind of been like, no, that's not a common cause, but I'm hearing it's more and more common. Cha-cha-cha, does estrogen stay in your tissues causing estrogen dominance? Well, that's a great question. It depends. Each person individually clears estrogen their own way. So for example, if you were running a marathon in 80 degrees, you would sweat a lot out and you would clear it fast. You'd clear water out fast. If you were a patient on dialysis, you wouldn't clear water out. So your own clinical diagnosis and your genetics affects how your body clears estrogen. So it really depends. If you're using a patch, it drives it in and it gets out. If you're using a cream, yes, it does stay in your tissue. Mish, do you recommend pregnenolone? So we do use that in our practice. Pregnenolone is a neurosteroid that is a precursor to cortisol and progesterone. It comes from cholesterol. It's made in your adrenal gland. We see it help for people who are anxious, who are exhausted, who have low cortisol. It also affects your NMDA receptors, so it can help with pain and inflammation. So we do measure it, and we do recommend it. I have been on hormone therapy now for 8 years, and I will never come off it. I feel fantastic. Very good, because now there is currently no age where it is recommended to stop. So don't let any doctor or provider tell you have to stop your hormones, because the American College of OB-GYN and the North American Menopause Society does not have an age where they say you have to stop. They talk about how soon to start, what the safest time to start is, but they do not say there is an age you have to stop it. Okay. Let's see. What do you think about all these peptide stacks that help with inflammation, hair, and skin and health? Camp Chaos. Great question. You know what? It's on my list of things. I purchased a peptide course and a couple peptide books. So I would not say I'm the expert. I would say that I have dabbled with some peptides in my family members, with myself, and in our practice, but I don't feel like I'm an expert yet to be able to do that. So just like anything, I think it has to be you have to be mindful and know the science behind them, and the right dosage. Like anything, too much or too little can affect somebody, and it's going to be personalized. So I think there's definitely some promise on those. Okay, you do glutathione injections. I'm going to hopefully get some glutathione this week as well. Chill, Will. I've heard there's a type of estrogen cream that can be used on your face for anti-aging. That's all the rage too. Listen, we've been using this for years, so the whole world is like catching up. I'm like a dinosaur because I've been prescribing hormones bioidentical for like 20 plus years. But anyway, estriol is the face cream, not estradiol. Estriol. So it's a weaker estrogen. It's supposed to be a lot better. I'm actually not using it for my face right now. I should probably get some, but I know there's a lot of companies that are formulating it, or we send it to our compounder to make it. Okay, fingers crossed you're 22. Okay, so for you, Vitex or seed cycling, check out Funk It Wellness. And I think on my Instagram, which is Hormone Guru MD, I'm pretty sure I have a discount code on there. So check that out. So if you guys aren't following me on Instagram, it's Hormone Guru MD, and my YouTube channel is Hormone Guru. I would love it if you could go subscribe to my YouTube channel. We're trying to get more subscribers, and we also have some brand new things on our channel. So we have free download of natural therapies for mood issues during perimenopause, menopause, really any age. We have a testing guide. People are always asking me questions about testing. So we have a free testing guide and a new free mini hormone course. So all free. Please sign up for our newsletter as well. We're trying to grow that list so we can kind of get the news to you once a week. We're not going to spam you with a lot of newsletters, about once a week, about current topics and current and also new studies. Nick 88, 13 years, very high SHBG, nothing bringing it down. Otherwise, I have great total T, no free T. 13 years, you're 13 years old, or for 13 years, you've had high SHBG. High SHBG is related to high estrogen. Wondering if you have great total, no free T, that's because you have high SHBG. So high HBG means most of your T will be bound and not free. So you do need to look at work on that. I'd be really interested to see what your estrone and your estradiol are. User 321307 was on HRT for 10 years and had to go off. Wondering why you had to go off, because I think that question's obviously lag, and I just addressed that. Really the only reason I think someone would need to go off is if they just got diagnosed with breast cancer. So what are some non-hormone options for menopause? Well, first of all, it depends on what the symptoms are. I like L-theanine, magnesium, and melatonin for sleep. I like 5-HTP for moods. I like black cohosh or a rhubarb supplement for hot flashes. Again, there's lots of other hormones besides estrogen. You may still be able to take DHEA. You may be able to take progesterone. Hard to know what your issue is. User 23213, but I hope you're okay. Steph, estrogen, progesterone, and testosterone. I still have terrible headaches and migraines. Interesting. Okay, Steph, that makes me wonder what kind of levels you have, because if you have high estrogen, that will cause you to have migraines. So I'm still finding that a lot of practitioners do not check levels, because that's not necessarily like the standard of care. I was taught that way for 20 plus years, and that's the way most people in an integrative and functional are. But many practitioners that are more traditional, thankfully, they are still open to prescribing hormones, but they're not really checking the levels. So that could be the issue. Because all those things, stuff should help. Cindy LaFlaca, what should we be looking for in an HRT practitioner? Great question, Cindy. Okay, so let me walk you through this. So I'm a traditionally trained OB-GYN, and I graduated from residency in 1997. So what does that make it? 28 years ago? Okay, that's when I was done with residency, not when I was done with medical school. I was done with medical school in 1993, so over 30 years. We get zero training for menopause. So what do? We had 3 months of a reproductive endocrine rotation that we learned how to evaluate people for infertility, and we learned how to, maybe help give them fertility drugs. But we didn't learn anything about menopause at all. And so when I finished my residency, I was in private practice, and being a young person, most of who I saw were pregnant people. Until 7 years into my practice, I had 3 little kids at home. I decided to take a year off of delivering babies and just do GYN. And then I started seeing all these menopausal people and not really knowing how to help them, because I wanted to help people. I went to a course on hormones in 2003. And so what's that, 22 years ago. And so since then, I've gone to more and more and more and more courses and learned more and more about it. And there's so many more studies and so many more resources for people. So the discipline necessarily isn't important. But if you want someone who can prescribe, they need to be an MD, a DO, a nurse practitioner, a physician's assistant. Some naturopathic doctors, depending on the state, can prescribe. If you're not necessarily interested in taking prescription hormones, Cindy, then you could see another like a naturopathic doctor who can't prescribe, but look at their website, vet their social media. They've got to do extra training. Now we all have websites, we all have social media, LinkedIn page. So you can go down their page and see what are their credentials. If you see a certified menopause practitioner, that means that they've done a little bit of extra study in menopause and taken a test and maintained. I've been that since 2006. That's a traditional approach to menopause. So where they are not afraid to give it, they don't necessarily do testing. Really, they don't recommend testing. They don't do monitoring, and they just pretty much prescribe it, which is still great, right? And so you could look at the American Academy of Anti-Aging and Regenerative and Functional Medicine, A4M. I think they do a pretty good job on hormone education. And I would have told you that before I was teaching for them. And so I'm one of their senior faculty and for their hormone level courses. So they have a provider directory there. If you go to their website and go up into the right-hand corner, it'll say resources and it's provider directory. Look for someone who is fellowship trained and board certified. Also, another way to get a provider is you can look at some of the lab testings directories to see who actually uses those labs. Okay. Do you do teleconsults from out of the country? That is a great question. So as a physician, I am limited. I don't want to say limited or bound by my medical license. I have a medical license to practice medicine in Ohio. I do have one in Florida, but it's going to expire and I'm not going to renew that because I live in Ohio. And at one time I thought I was going to start limited to that. Out of the country is tricky. I think it depends on the laws on where you are. So we sometimes see patients when they come. I have patients that come from Canada, but they have to see us face to face first. Aaron McCormick, is it too late to start HRT at 56? Absolutely not. Within 10 years of your period or before the age of 60. User 4670, what is for mood? So there's a few things that can help for mood. One of the things is fish oil, especially if you're a younger person. Look for a higher content of DHA rather than EPA. I like 5-HTP. Start with 100 milligrams. That's a serotonin precursor. That helps for moods. Rhodiola can help sometimes for moods. GABA can help for moods as well. For PMS, there's a lot of data on calcium. I haven't found that to be helpful. Okay, we've got a few more minutes to try to get through. Let me catch up on these questions. Cindy, okay, I think I already answered. Can I do vaginal progesterone, vaginal estrogen at the same time? Do they compete for absorption? There is so much of a surface area. So yeah, I probably wouldn't do them at exactly the same time, but to try to space them. FB Tampa, what is DHEA for? So DHEA is the source of all of your hormones after menopause. It comes from your adrenal gland. It has to do with immunity, metabolic issues, strength, stamina, muscle strength. Is my question getting filtered? Oh, possibly. Triple Purple Heart. That's sometimes why I'm not seeing the questions, is because I wasn't even aware it was getting filtered until someone else said. Maybe that's the vaginal, that you had to correct the words. But yes, non-hormonal options for mood. I think I just answered that question. Why did my period stop after getting Depo? Well, that's the whole point of Depo, is to prevent ovulation. So without ovulation, a lot of people do not bleed, and that's what Depo-Provera does. I'm thinking that's what you mean, Katya, is Depo. Cody, the blue nose, can low hormones cause dental problems? Great question. You guys see, I am using Invisalign because all of a sudden my teeth totally shifted. I've had braces as an adult, so it wasn't that long ago. It wasn't a teenager, but all of my teeth crowded. So I did a Google search. I put a video on here. You'll have to go back a couple months. And yes, what they see is the lowering of estrogen relaxes the teeth and also the bone density. So yes, it can cause dental problems. Okay. HRT did not work for me. My doctor was nice enough to provide other option that isn't HRT. Well, great, Pat. I'm not sure what the issue was, but there are some people that can't tolerate it or choose not to take it. Rachel, I was taking bioidentical hormone pellets, but I just can't afford the option. And that's one of the reasons why we don't do pellets in our office, is because a lot of our patients, most of our patients, can use their insurance for the hormone. So the estradiol patches are generic. There's 5 different doses. There's an estrogen gel that's generic, so most people come with a nominal copay, anywhere from $10 to $30. And then the progesterone also anywhere from $10 to $30, depending on your copay. Now, if you don't have insurance coverage, unfortunately, even a generic patch can be $80, but you can go to GoodRx and get a discount code. So it's about $35. And so that's one of the reasons we don't do pellets, because we want our patients really want to be able to use their insurance. Nick 88, estradiol 48, so high but not crazy high. Okay, so wondering if you have an aromatase SNP, Nick. I'm seeing if you are presenting as male, then I'm guessing that you may have an aromatase SNP, and you may benefit from an aromatase inhibitor to keep your testosterone and lower your estrogen. Yeah, using estradiol in menopause, but getting repeat UTIs. A lot of times, repeat UTIs can also be the lower estrogen, but also lower DHEA or lower testosterone. Maria, do you think HRT can make fibroids grow bigger? So fibroids are sensitive to hormones. I haven't had that problem in my patients, probably because we keep the doses lower, but the best for them. But yes, they're going to be fed by hormones, especially in excess. Purple Heart, if my testosterone is 7, would you be using 1 milligram of testosterone be enough to help? Well, it could be. A lot of times we start lower because testosterone, like any hormone, you have to increase it gradually because it works through receptors. So when you start really high, it doesn't always do well. Some people might be fine. Just like if I wanted to tell you to run a marathon, I wouldn't tell you to run 10 miles tomorrow. I'd tell you to start with 2 a couple times a week. So, but that doesn't sound like a crazy high dose to me. Okay. Thank you guys for the badges. So FB Tampa, there is actually a Forum Health in Tampa. So I belong to a practice called Forum Health. Our site is in Akron. There's over 40. There is a Forum Health in Tampa. Dr. Shilpa Saxena works at that. Yeah, there is a doctor like me in Tampa. Not the same, but I'm 63 and on my HRT, puppies and kittens. Good. Let's see, prolactin is 36 and cortisol is 19. Okay, so 36 I think is on the borderline. I don't know offhand. I think 27 is the upper limit. So with our patients that have low prolactin, we're going to repeat it again fasting and then take a look to make sure they don't have a microadenoma. Cindy, what helps with libido? Oh my gosh, so many. Libido has to do with so many hormones. So a lot of times we would look at all of your hormones. It's also your relationship. And, for some of my patients, hormone replacement doesn't really help with libido, but husband replacement does. Just kidding. It's a bad joke. Sorry. But not to joke. I think that DHEA and testosterone and estrogen is really important for libido. Thank you, Sarita, for the compliment. I just got it done today. Relly Ruli, I've been using HRT, estrogen patches, and progesterone for over 3 months, and I'm not seeing any change. Okay, so Relly Ruli, if you're starting on the lowest dose, be patient. It takes about 3 months to evaluate a dose. You might need a dosage adjustment. And maybe you need some androgens. Puppy's Kitchen, my DHE is very low. What can I do? Well, actually, there was a study that something called heart math, which is a form of biofeedback and meditation, could actually help raise that naturally. Which kind of vaginal estrogen is best for bladder problems? I actually prefer vaginal DHEA far better. Estriol would be my second choice. Estradiol, third choice. User 3213, I was advised to go off of HRT during the increase in cancer. No, that's no longer accurate. Actually, there was a study that was published in February, 7 million women over 65, and they saw a decrease in breast cancer, a decrease in lung cancer, a decrease in colon cancer. So the risk of breast cancer is thought to be 1 in 1,000. So your risk as a woman is 1 in 8. Now your risk goes to 1 or 13.01, 13% to 13.01. So the increase of 0.01%. So that's actually not accurate, but that's old data. Side effects of progesterone cream. Too much progesterone can make you bloated and have breast tenderness. Rachel, it is Forum Health. Forum Health. Yeah. And so we have sites, I think 40 sites all over the country. Not all over, but yeah. Cindy, I was just kidding. No, it's terrible that I said that. You don't have to switch. No, I'm just kidding. That just was my situation. Okay. I have had low cortisol for years. How damaging could this be? So the thing with low cortisol is there is associated with low immunity, more autoimmune issues, and also if you have um, something like cancer, it may also affect your prognosis. Stacy Lynn, I heard estrogen causes cherry angiomas. I'm getting so many. Are you taking oral estrogen, Stacey? Or maybe you're not taking it and you just have some. I'd really want to look at your liver detoxification. Thoughts on trends that promote medical disinformation like cortisol face in non-Cushing weight patients? That's a tricky one because you can have high cortisol but not have Cushing's. And there's a lot of things that can affect how you put your weight on in your face or not. So I think you're right. There could be some medical misinformation around there, but I think it's not a given that there is a cortisol issue. C good 42 estradiol is normal for menopausal women, also on testosterone shots and progesterone. So for 42, the latest study that came out said anywhere between 50 and 100 and maybe even more than 100, depending on the patient for good estradiol levels. Cebu, any recommendations for PCOS? A lot of times, my favorite things are inositol, 1 gram twice a day. Sometimes Vitex also happens. I think Da Vinci Labs has a supplement called inositol plus Vitex. That's one of the ones that we use. Why is no one looking at the root cause? That's what we do in my practice. So why is no one else looking at the root cause? I think that's because we're not trained that way in traditional medicine. Heavy bleeding, palm-sized clotting, abdominal fullness. ER sent me home. What can help? Kristen, I don't know how old you are, but some of the things that can help your bleeding just short term is taking ibuprofen every 6 hours. There is a medication called tranexamic acid also that is not a hormone that can help the bleeding. You may want to think about getting that. Okay, I have time for one more. Sorry, my battery is going to go, so I always have to limit that. So Climera Pro patch, I like that it's transdermal estrogen, Santiago, and it is bioidentical, but it is a synthetic progestin in that Climera Pro patch. So I don't like the synthetic progestins. They have been associated with an increased risk for breast cancer. So thank you for everyone who's been joining me. And if you didn't check out my herbs, take a look at my herbs, and hopefully you are enjoying the weather. And thanks for hanging out with me here. And make sure if you're not following me on Instagram, Hormone Guru MD, please subscribe to my YouTube channel. We are building subscribers and sign up for our free website. And if you haven't checked out our new free resources about mental health and testing and our mini course, go ahead and check it out and check me out. Actually, next Tuesday, I will be in the Grand Tetons. I don't think I'm going to be doing a live. I'm running a race in the Grand Tetons, and then the next week I'm running a race in Yellowstone. My friend and I are running a half marathon in every state of the country, so we will be out of town. So thank you for tuning in, and I'll catch you the next week. Uh-oh. My sister was on.